the last few years have seen the emergence of a number of biologicals, monoclonal antibodies against different mediators in asthma, and these are changing the way that we approach patients. So they're helping us with personalized medicine, and there are some which have been for some time, like for example omalizumab, and this is now finding new ways and new indications for treating patients, but also other antibodies are coming up, like anti-IL-5 antibodies, anti-IL-4, anti-IL-13. So the biologicals are really an exciting development, but at the same time you have other new medications coming in asthma. For example, combinations of inhaled steroids with LAMA, long-acting muscarinic antagonists. They have been used in COPD, they're getting into asthma, and especially they will be coming slowly also into pediatric asthma, which is mostly my area. Other new medications, so it is a very active period in new treatments, pharmaceutical and biological treatments for asthma. There is a continuous unmet need to actually identify asthma. Asthma is a very frequent disease, but it's not identified as frequent, and when it's identified, it's not easy to manage. So I think the unmet need is to have biomarkers with which you can diagnose asthma, and again biomarkers with which you can follow up. And we're going towards an era of personalized or stratified medicine, where we need to have good tools in order to characterize these patients so that they will respond better to treatment. So this is a big unmet need. And of course, another unmet need is to be able to collaborate better with patients so that they adhere to their treatment, because that's the other challenge that we're facing, that patients do not follow the treatment, sometimes because they don't understand it, sometimes because it's very complex. What I have actually seen very much in this Congress, and also there's an increasing number of publications, is about the microbiome and the microbiological content of, in addition to the gastrointestinal tract, also of the respiratory tract and the airway. And it seems that we're seeing more and more about a role that the microbiome can play in either the pathophysiology, or it might have some clinical uses in identifying subphenotypes and understanding better different groups in asthma. So I think this is really exciting. We are also working very much into this area, focusing on the viral aspect on the microbiome, which is neglected. And we see that these microorganisms, which in the past we didn't know that existed, that they were there, they interact with the immune system and they drive many of the immune responses that are associated also with asthma. So I think in the next few years, research and new developments in this area will give us really great news. So I've heard some very nice presentations about developments in known cells, but on the further typing, for example, in subtyping mast cells or innate lymphoid cells. And also something that I really enjoyed was the description on how you get from a disrupted epithelium or an epithelium producing a factor that will activate the immune system or innate lymphoid cells, and then they will produce some factors that they will disrupt the epithelial barrier. So some talks about the new developments in the pathophysiology of allergy and asthma in particular have been really exciting. Of course, there are so many talks in this Congress that there are many more to enjoy. I think that we're living in very exciting times. The problem, of course, is big, it's major, but we are having new tools, and I think we're going to be having more opportunities both to understand the diseases that we're treating, but also offer better treatment to our patients. So I think they should engage more with research, they should try to understand and be good doctors.